I'm not surprised in that this has been a century of pandemics, and we live in a world of emerging infectious diseases. As human beings, we are spending far more time with other species than we used to, living in areas that we never lived before, consuming uh, animals that we never consumed before. And we have a global village right now where an outbreak anywhere can quickly go everywhere.
I'd like to get a bigger perspective on where COVID-19 fits into the history of diseases in the world. And joining me now to talk a little bit about that is Dr. Howard Markel. He's the director of the Center for the History of Medicine at the University of Michigan and also the author of When Germs Travel. Dr. Markel, it's good to see you.
Thanks for having me.
I'm sure there's been a lot of interest now in speaking about your book, which was published back in 2005.
2004. And then there was an earlier book in 97 called Quarantine. And then there's been a lot of work since, but yeah, whenever there's a pandemic, it's sort of my busy season.
There you
And
go.
yeah,
So let's go ahead and talk a little bit about answering the basic question of what can we compare COVID-19 to?
well, it's really hard. I mean, there's been a lot of comparisons. 1918 influenza pandemic is one of them. The problem is that just like there's a different cast of human characters in all these pandemics, there are different microbes, and they are living beings, and they react and spread and transfer in different ways. So COVID-19 is a novel coronavirus. We have no experience with it in terms of our own immune systems or in our much larger social, political, and economic systems as well. The 1918-19 pandemic of influenza is well known as the worst contagious crisis in human history. And that's because it killed anywhere from 40 to 100 million people worldwide. And of course, it killed at least 600 to 750,000 Americans that year, and about 14 million Americans contracted flu. It also had a case fatality rate, that means number of deaths divided by the number of cases, of about 2.5%. And in some areas, it was as high as 10%. So it was very, very deadly. And so, in terms of numbers, COVID-19's case fatality rate, which may be 3%, but hopefully will be far lower when we get a much better denominator of mild cases, has sounded the alarms for old-fashioned methods of social distancing that we have looked at during the 1918 pandemic, and that they chose because they had nothing else to do.
So are you surprised at where we find ourselves now in the US and around the world?
I'm not surprised in that this has been a century of pandemics, and we live in a world of emerging infectious diseases. As human beings, we are spending far more time with other species than we used to, living in areas that we never lived before, consuming animals that we never consumed before. And we have a global village right now where an outbreak anywhere can quickly go everywhere. So I'm not surprised that we're in the situation we are in, although I would have never predicted the particular microbe in question.
So it brings me to the question of where is the sweet spot of reaction? We talk about closing down borders, we talk about social distancing, but now really kind of the lockdown of where our society is right now. Where do we find that the best position is to be in?
Well, that sweet spot, you'd almost have to be Babe Ruth to hit that one out of the park. It's very hard to achieve that. And the history of epidemics is littered with public health officials who reacted either too early, and then people complain because a great deal of money is lost and society is disrupted, or they acted too late and people get sick and die. Now, we studied the Center for the History of Medicine at the University of Michigan, working with the Centers for Disease Control, studied 43 American cities during the 1918-19 pandemic. And they had a menu of non-pharmaceutical interventions, as we call them, of three main things: quarantine and isolation. You isolate the ill and you quarantine those you suspect of having contact with the ill. School closures, and public gathering bans. There were no vaccines, there were no antivirals, there weren't even IV fluids. So these old-fashioned methods were all that they had. And those cities that acted early, before the inflection point of flu spreading and circulating throughout the community, layered, meaning they used more than one, and for a long period of time did far better than those cities that did not. Now, that inflection point that we determined using 1917 data, and of course, that's what the health officials were using then too, was at about 2 times the rate of flu in their community at that point in time. But with COVID-19, we don't have 2018 data because it's a novel virus. So we're really flying by the seat of our pants, and that's why a lot of us, myself included, we're saying it's far better to act early rather than late.
Do you believe
Because once it's out there, it's out there.
Do you believe that we have acted early in the United States?
I think we could have acted earlier in some communities. I must congratulate Governor Whitmer for taking a very bold stance and acting decisively to do those things. Schools closed quickly. The universities closed a little bit more slowly. Public gathering bans have ended. And so I think we did, but we won't really know until it's over. Other places like New York City, which is now the epicenter of the American COVID pandemic, probably acted a bit too late, and they were fighting about these non-pharmaceutical interventions and delaying them.
How do we look back at history and other diseases that have come through, and knowing that we are facing something that we have not seen before, about in terms of closing borders and acting globally? How does this show that maybe we need to change the way we deal with our healthcare systems around the world and coordinate in a better way, or is that even possible?
Well, it's an excellent question. And the final act of most pandemics across time is something I call global amnesia. So people will say, SARS, what's that? AIDS, tuberculosis? Well, and we keep forgetting.
We forget quickly, don't we?
Yes, we do. And we go on our merry way, and these microbes come back. And so one thing we have learned again and again is not only do we live in a global village with a global economy, a just-in-time economy, is that we're all interconnected. And so we need to have excellent health agencies, public health agencies at the local, state, federal, and international level that cooperate with one another, that communicate with one another, that do not conceal an outbreak for a month or longer, giving that microbe a running head start. And that, you think of it like this way: you have a fire department in your city, and you pay for that through your taxes, but I'm sure your house did not burn down last year. And nevertheless, you're glad you have a fire department, because in the case of a fire, they'll be there. And the same can be said of our public health agencies and departments. They are essential to protecting our public health. And planning for pandemic preparedness is essential, because it's not an issue any longer of if we're going to have a pandemic, it's an issue of when. And it's not just COVID-19. There was influenza of 2009. We've had Ebola outbreaks. We've had SARS. We worried about avian flu in 2005. We live in a world of emerging infections, and they have ambitions too. These microbes want to attack and infect us.
What do you think the appetite for that kind of connectedness in our global health community is coming out of something like this, when there is going to be using resources for economic gain? There's going to be need for resources in so many other areas.
Yes, because these episodes cost a fortune, and this one's really costing a fortune and a half. My hope, this is the doctor side of me, my hope is that we will do the right thing and plan. The historian in me is somewhat pessimistic, because I have read post-mortem reports after epidemics and pandemics going back hundreds of years, and they're always identifying this problem and that problem, and then the society in question goes on its merry way and doesn't correct things that started that epidemic or pandemic in the first place. We can't afford to do that anymore, economically, socially, mentally, and surely physically.
This will be another chapter in your expanded book, I'm sure, that will be coming out in the next couple of years. What do you think that we can expect locally in Michigan in the coming weeks, just from your perspective of how things have been handled so far and your knowledge of diseases that have come before us?
Well, none of us have experience dealing with something like this infectious, a pandemic, uh, as our grandparents did. So in 1900, 1 out of 5 babies born would die before their first birthday. And in that same cohort, 1 out of 5 would die before their fifth birthday, largely of infectious diseases, diphtheria, measles, whooping cough, what have you. But there are also smallpox epidemics and flu epidemics and so on, polio, cholera. And so people were used to dealing with the threat of infection, these invisible foes. And we don't have that experience, and now we're getting it. So one is we can all do our part by following the rules of social distancing. We should all get immunized for influenza as well as every other infectious disease that we have good, healthy, solid, and safe vaccines for. And we have to talk with our public officials and make sure that they govern rather than snipe or play gotcha to get us through this crisis and plan for the next one.
Okay, Dr. Howard Markel, thank you so much for joining me. I appreciate it.
You can find more at onedetroitpbs.org or subscribe to our social media channels and sign up for our One Detroit newsletter.